Hello, dear colleagues and friends. Welcome to our webinar. This is a translation of a speech of Tatiana Kobylkina, doctor, naturopath, homeopath, nutritionist, BRT/VRT diagnostician. She has over 40 years of experience in traditional medicine and over 25 years of experience in alternative medicine. In traditional medicine, she had a specialization in cardiology and neurology. In alternative, bioresonance diagnostics and therapy. The topic we have today is healing with the help of bioresonance. When I was working at the inpatient department, I used to work in 5 inpatient departments during my practice. There were situations when we could eliminate some symptoms very fast. But when these people come again and again many times, very often they become at some point disabled. Especially it happened during my experience in the allergic department. So I asked myself a question: what are we doctors doing? It was back in the 90s, and I started reading literature. First books about the organism cleansing. For a few years, then, I've been practicing the liver cleansing methods, in short time stationary starvation, and I saw amazing results. And at that period, I understood that there exists the biophysical medicine and biochemical medicine. And mostly the doctors teach the biochemical medicine. And we, as physicists, were taught the biophysical medicine. And the biophysics has more significance because it creates the biocontour of the frequencies. And this understanding of the biofields I was learning about back in the 90s at the courses of extrasensory perception, which were very famous back in the days. There is not only the physical field, but also ethereal field, astral, mental fields, etc. But we work mainly in the ethereal field. And now I would like to tell you briefly about what I learned during my years of experience. Each cell has the electrical potential, and the methods like cardiogram, encephalogram, etc. allow us to see this potential. But the same way, viruses and bacteria, worms, parasites have their own electrical potential. And all of this we have in schemes. All this information is already in our diagnostic devices, so we can see it without taking any analysis like blood, urine, stool analysis. There are disharmonious oscillations and harmonious oscillations. If a person has strong health, he or she will always have a certain level of the immunity which controls all this micro-world, although this micro-world is much bigger. For one cell, there are 10 different microbes, but every 10th cell is immune cell. So if the range is lowered, if the range is from 77 to 9000 Hz, then this is the range of the pathogenic flora. If the range is higher than 10,000 Hz, this is the range of a healthy cell. And the first thing I start with is I explain to the patient that the disease is the dominance of disharmonious oscillations over harmonious ones, and that this biophysical imbalance leads to the dysfunction of 3 regulation systems: nervous, endocrine, and immune, and it leads to the toxins accumulation, and then later there starts a disease. First, I look at the health group according to Vitulkas. Please make a pause to read the description. The age is not important here. There are people who lead an active lifestyle, don't take medications. Even being in an older age, they have a quite strong health. In this case, the disease passes quickly and the results of the device's applications are very good, because what do we do in this case? We just increase the energy potential. We bring it back to the range of the physical health. The second group, a person gets sick easily. He or she can't recover quickly because the course of the disease is not as quick as compared to the first group patients. In the first group, by the way, the remission is prolonged. Meanwhile, in the second group, the remission is short-term. They often take various medications, meaning the patients of the second group. And it's hard to pass to the first group, and these patients proceed to the further groups, third, fourth, etc. The third group is when there is no fever, no reaction, but there are some chronic states when the organism almost doesn't fight the disease. It has energy deficiency. The person has only strength to fulfill the physiological functions. That's why the treatment is long-term. Sometimes, if the treatment is correct, then this person can pass to the second group. But unfortunately, more often they pass to the group 4, 5, when the organism stops completely to fight. Here, the resources are at the zero level. There is a lack of immunity. At this background, very often there appear some mental disorders like depression, phobias, etc. Usually, to the alternative specialists, there come people from third and fourth groups, because they are overtreated. All the detoxification systems don't work. And here, as a homotoxicologist, I can say that the disease is the manifestation of the defensive forces of the organism. The organism tries to resist outer and inner toxins. I would like to show you the 6-level pathology development system according to Reykjavik. So, we live in the outer environment, and we have such called endogenous toxins. These are inner toxins. And exogenous toxins, meaning the outer toxins. And there are various viruses, chemical reagents, which we get from air and water. We have some bad habits, and of course the significant impact has stress. Endogenous toxins are simply slags, the biochemical disorders that we have. And all of this needs to be somehow drained. It is drained through the excretory system, through intestine, through urine, sweat, feces, through skin, etc. If the drainage is not sufficient, then these toxins are being accumulated, not only in blood and lymph, but also in the intracellular matrix. According to intoxication, the matrix has 83%. This is the place where the cell lives. The cell itself has 7%. Blood also 7%. Lymph 3%. All of our medicine is based on the tests measurements. People come to me with a lot of test results, but it's only 7%. When the toxins are accumulated in the cell matrix and then pass through the biological membrane inside of the cell, then there occur deeper disorders up to DNA disorders. And Reykjavik developed a classification of the homotoxicosis stages. You can see them on the picture. And the first 2 stages is a good variant, one we can help very quickly. We can use our devices or just herbal medicines. Herbal medications. But unfortunately, these days, I have a lot of young patients coming with the 5th stage being only 30 years old, because they have been overtreated previously. And at this stage, the toxins not only are accumulated inside of the cell, but also turn into formations. For example, the 3rd stage is formation of polyps, cysts, warts. The 4th stage is when the processes get deeper, and there appear autoimmune diseases like Crohn's disease, autoimmune myocarditis, etc. And now these diseases are very common, especially in patients who were hospitalized. And the fifth stage is the stage of benign tumor formation. And the stage 6 is the transformation of benign tumor into malignant tumor. And today, usually, people come with a health condition of the third and fourth stage. And I understand the volume of work I have to do with this patient to help this patient out of this state. And the way out of this state goes through the second stage, the stage of aggravation and immunity work. Herewith, the toxins should get out of the cell into the intracellular level, out of intracellular level to lymph, out of lymph to blood, and only in blood the immune system works. Because all the medications prescribed by the doctors have impact only on the blood level. When we apply our device, we are able to take these toxins out of the DNA. Do you understand the uniqueness of this device? And we are able to change these stages. We can gradually climb up from the lowest stages to the stage 1, when there is a normal release of toxins through our detoxification systems. And when such patients come to me, I warn them not to worry about the aggravation. It's impossible to launch the process another way. So, here we have the Trinity device. This is a device of low-frequency electromagnetic therapy. It has two principles of operation. Number 1, the neutralization of pathogenic flora, fungi, bacteria, viruses, due to their destruction. And number 2 is the activation of physiological oscillations. A lot of patients that come to us, to the alternative medicine specialists, these patients are often very overtreated by our colleagues. And if you read about the medications, they have an effect of blockage of cell receptors. People don't understand what it means, but the doctors understand that. And they understand that the cell becomes unprotected. And it turned out that the cell receptors are restored due to the work of our device. They start to work the same way they used to work before the medications intake. And this way, we can restore the healthy rhythm, restore the homeostasis. First, the biophysical homeostasis, then the biochemical homeostasis. Then there gets turned on the person's own program that we all have, of the program of self-regulation, self-restoration, self-healing. People forget that we didn't have medications back in the times, because we all have this self-healing program in our bodies, and a big significance have our emotions, positive, negative. You see, they all have their frequencies. And all these frequencies are recorded and are programmed in our devices. We have an amazing fourth mode. On the picture, you can see only a part of programs that are uploaded into the device. And when a person is stressed, he or she should turn on a program just for 15-20 minutes, place the device near the head, and there happens stress relief, mind cleaning, etc. And like this, our brain synchronizes with these frequencies and launches the system of self-restoration by itself. We also have a lot of detox programs in our device. And due to normal immunity functioning, detoxification, a person starts to turn on his or her resource. And we live, by the way, only using 10 to 15% of our resource. But when we turn on all of our resource, then the organism works at its 100%. Our device operates in the fourth mode on the psychological level, and the other programs impact the physiological level. And I would like to share some cases from my experience. The patients that I've been working with for a long time all have these devices. And sometimes there come women with painful period. And there is a pain relief program in the 4th mode, and it helps to get rid of such pains. I can say that from the words of my patients. We have a lot of programs to treat children. There are programs for SARS, flu, angina, and also we have programs for immunity increase and stabilization. I had cases with my patients that when a child had a high fever and his mom applied the immunity stabilization program, the fever decreased without taking any medications. Also, a lot of good results are from application in the field of gastroenterology. A lot of elderly people come to us because they don't have strength anymore and the organism does not react to the medications. Our users experiment with the complexes and programs. They apply different ones and they look at the results, and then they know which ones are the best in their situations. So, dear colleagues and friends, we invite you to be our partners, clients, patients, and we wish you health and all the best.